bodies are designed to function well with sunlight. That we've done, like, let's talk about sound. How do you use sound interventions?
Well, let me take an extreme example of a very challenging situation. Let's talk about something like autism. But what I'm saying also applies to many learning disorders. Autism, again, is one of these complex disorders, so that no two kids with autism are identical. And you have to address all the stages, in my opinion, of neuroplastic healing to get a chance at improvement. But this is something that's very well known. Kids with autism, the majority of them are actually hypersensitive to sound. So the scene of a kid, you know those very noisy walkways in airports, for instance, or escalators,
right,
or certain machine sounds. They really trouble those kids, and they're covering their ears all the time and often screaming. There's a number of sounds that really trouble those kids. And there's so many symptoms in autism that clinicians used to think, well, that's just part of the autistic package in many, many kids, but it couldn't be all that important. Well, it turns out it's actually really important, sound sensitivities. So when you walk into a party, and there are a lot of people there, it's kind of booming, buzzing, confusion, and there's just kind of a rumble, you can't make it out. But over time, you start to focus on individual conversations. There's some people are talking about religion here, and politics here, and romance here. What's happening is, just as in a camera there's a zoom lens, in your ear there's like an auditory zoom that can focus in on the frequencies of human speech. And in autistic kids, many of them with sound sensitivities, or in kids with sensory integration disorder, or in kids with auditory processing disorders, that auditory zoom is often not working very well. Now that's really important for the following reason. For human beings, in fact, for all animals, there are certain frequencies that we communicate with other human beings. And in those frequencies, most people are pretty comfortable with. We evolved to be comfortable in those frequencies, the frequencies of human speech. But there are other frequencies. Those are sounds that, for instance, predators, animals that kill us, make. And those make us very anxious for fight or flight reasons. We don't want animals that prey on us to be able to hear our communication frequencies. And we are really sensitive to the sounds that they make. Now, if you think about going to the movies, and if there's a monster coming on the screen, if there's an alien on the screen, if there's a shark, the music is always very, very low. And it's just very, very frightening to hear that low sounding. If a person is possessed by an alien, you'll forgive me, but in some very low, frightening sound. Now, autistic kids are not hearing human speech sounds, which are calming to us. They are often hearing sounds which are very threatening. And so they're covering their ears to block out the sound, but also to try to regulate their fear and their terror. That's really, really important to understand. So a French doctor named Alfred Tomatis made a series of discoveries, and one of them was that you could actually train up an auditory zoom by taking certain kinds of music and modifying it, so that at times you're triggering something they're comfortable with and something they're uncomfortable with. And so this is now one of the part of the package of treatment for autism, and it's not widely known, but I have definitely seen cases of autistic children who are severe go to becoming mild, and occasionally, not always, but at times, seen kids who are significantly autistic fall off the spectrum. And there are cases of kids who are autistic who do fall off the spectrum, and there's not, most parents are told autism is genetic, there's nothing you can do about it, be mature as a parent and adapt to it. But there are more and more cases, histories of people who are very well diagnosed, who with different kinds of interventions make significant improvements and occasionally even fall off the spectrum. And so what happens is, in these situations, is the kid will come to a place called the Listening Center. That's one of the places that does this in North America, the one that I've studied the most. And they'll start listening to modified music. They tend to work with Mozart, perhaps because there's a number of reasons for that, but it's higher frequencies that are kind of lay the groundwork for human speech, and then they fiddle with it, they modify the music. And as they start to develop the auditory zoom, and sometimes it can happen in several days, kids will do amazing things. They will turn to their father for the first time and hug him. And their speech will improve, and they lose their sound sensitivities. So, what's happening here is the following. It's complicated, but it's really important to know. When you're in fight or flight, you really turn off what's called the social engagement system. The social engagement system is that system that allows us to modulate our speech, to look people in the eye, to hear the frequencies of human speech, amongst other things. If you want to connect with people, all of those things have to be done. And the ear and the brainstem, if you're constantly in fight or flight because of the sound, you will turn off the social engagement system. This is such an important fact because, some people will say that the essence of autism is the inability to model other minds. And if that's the case, how is it possible that a kid listening to music can, within several days, suddenly express love for their parent? What that tells us is they had that capacity. And by the way, some parents sense that. They had that capacity, but it was constantly being turned off because they were in fight or flight because of the ear problem. And you can use this to help kids with attention problems. Some attention problems are actually listening problems and auditory processing problems. You can use it for a range of problems. There are patients I've seen who had traumatic brain injury. By the way, they often will get hypersensitivity to sound. And sound can be an important component of their treatment. And there are other things you can do with sound too. But again, what's happening here? We're using patterns of information contained in energy to modify the brain circuitry and resculpt it, build new processors in some ways, silence the noisy brain so that the brain can function at capacity.
So this is a great example of using energy to promote neuroplasticity because you're not giving anybody a pill, it's not a pharmaceutical drug. You're having them listen to music or sounds in ways that are going to enable them to activate their auditory zoom, to turn off is like they're not hearing the soundtrack of Jaws going in their mind all the time.
Or very frequently, yeah.
Right, so that I can't focus on you, I'm too busy being scared about this impending shark.
And not even understanding why I'm so scared, which is also disorienting and even frightening.
Right, just your heart.
And why is
pounding.
nobody else scared? Why am I scared? There's so many things that those children are going through. And you see, there are some medications we have in medicine that actually go in there and fix a problem, like an antibiotic when it's working and used appropriately and not overused.
Right.
But most of the medications in psychiatry and neurology don't fix the problem. They're not even designed to fix the problem. The model that people have is the system is broken, the brain is broken. You hear that phrase. It's a machine and it's broken. And so what we're doing is we have a medication that props up the failing system. But stop the medication, forget your dose, and the symptoms and the problem returns. What's beautiful about this kind of intervention is you're actually training the brain. And once they get it properly differentiated, there is an element of neurodifferentiation in their auditory cortex with this kind of training. And they learn to properly modulate or neuromodulate their emotions because their fight-flight system isn't always being turned on inappropriately. It's not as though they have to walk around listening to music all day long. Like, the therapy is typically something like 15 days. And then you might wait for a number of months and then do another session, and maybe once a year for a few years. But basically, that's it. It's in those cases, I don't even want to say the problem is fixed because that's kind of a machine metaphor.
Right.
Their brain grows out of the problem, or it accesses its potential, or it heals itself. And I think healing is an appropriate word here. You know, healing comes from an Old English word, and it really means to make whole again. And I think that's what's happening there.
So we've got sound, we've got light, and another recommendation you have in the book that you discuss is the possibility of online programming